Okay, Susan, I believe we are now live if you want to call the meeting to order.
Sounds good. Okay. Good afternoon, everyone. Welcome to the School Committee of the Whole meeting. Today is Wednesday, December 9th at 1:06 in the afternoon. Roll call of the members.
Mrs. Bronston Rizzo,
Here.
Mr. D'Ambrosio,
Here.
Mr. Ferranti,
Here.
Ms. Gravellisi,
Here.
Mr. Sinella,
Here.
Ms. Ty,
Here.
Mayor Arrigo.
Good Lord.
The mayor will be joining us shortly. Today we have two items on the agenda. We would like to go out of order. If one of the members would like to make a motion to change the order of the agenda and go into executive session for agenda item number 1 after we discuss agenda item number 2.
I'll make the motion.
Second?
Roll call.
Mrs. Bronston Rizzo,
Yes.
Mr. D'Ambrosio,
Yes.
Mr. Ferranti,
Yes.
Ms. Gravellisi,
Yes.
Mr. Sinella, Ms. Ty,
Yes.
Mayor Arrigo.
Absent. Okay, today, starting with agenda item number
Who
2,
started?
discussion for reopening schools. Dr. Kelly?
Thank you very much. I know that we've had several discussions about reopening at each one of the school committee meetings that has happened
Trying to send you again.
since
Basically-
the middle of the summer. But I also know that parents and families are feeling anxious about hearing more of what's going on. So I did prepare just a brief presentation to kind of review where we've come from. I want to acknowledge at the start of this that there are a lot of people who feel differently on both ends of the spectrum about where we are with remote learning, about where we are with a return to in-person learning, about where we are with athletics or no athletics. And, you know, some of the struggle there is that we hear so many different things in local media around the state of Massachusetts, but also in the national media about what the right thing is to do in the face of COVID. And quite frankly, it's beguiling. I know that. But one thing that I'd like to say to everybody is you really need to understand that with all data that you're looking at and with all information that you're looking at, it's very context specific. So, for example, one of the things that we hear a lot is the debate around whether or not it's safe for kids to be in school in light of COVID, and whether or not it's better off for kids to be in school for their social and emotional well-being as opposed to being isolated at home. And so we hear different reports, we hear different studies that have been conducted that have different findings in both of those areas. And regardless what any particular study shows, you really have to consider the context of where that study was undertaken, what students were involved in, what the COVID context was for that environment. And it's not necessarily the case that where we are in Revere is going to match perfectly to what we see happening in other communities across the Commonwealth or across the nation. So with that said, I want to, if I can share my screen here, hopefully this will work. Let's see here. I want to share with you a few of the different resources that we have had since the beginning of the summer, or the end of the summer, really. And the first one is our own reopening plan, which is located on our website, reverek12.org. And the reopening plan talks about our current remote system for learning. It talks about what hybrid learning might look like, and it talks about what in-person learning might look like. And all right, that's not working. I'm going to just jump to that page very quickly. All right, bear with me here. Why is it not letting me share? Okay. All right. When you go to the Revere Public Schools website, you see this homepage. And there is a scrolling text of information there that should be helpful to families. And one of them is this one, our fall reopening plan. So I'm going to click on that. And there are many resources here that have been here for some time, including the notes from our executive summary of our virtual town hall that we had back in June, when we talked to parents and students and teachers and others about what returning to school should look like. The other town hall strategy session that we had at the end of July, preliminary surveys from parents and reopening ideas. We just completed another survey, which will be posted here soon. We have the readiness guide from the Parabola project that was instrumental to our reopening, as well as the DESE fall initial school reopening guidance, which has been updated throughout the fall. There are protocols listed here for how you respond to COVID-19 scenarios. I suggest everybody read that. And then we have our site for family, remote, and hybrid learning resources. And above that, the very first link is our reopening plan. It has a cover letter that explains a bit of how we got to where we are. And this is, of course, dated September 15th, which was right before school reopened. And if you go in, you can find our actual reopening plan in 4 different languages. I'm going to open the English one. And I just wanted to highlight for facts that if you go in here and you actually read through the document, you'll find that there is guidance here about what a hybrid model would look like for us. It goes through who participated in the crafting of this plan. There's information about teaching and learning across the 3 models, and other information. I'll let people look through this at their leisure, but I just want to point out, because I've heard a lot of people say, well, why is there no plan? That we do have, extensive plans, and the plans talk about coming back, what coming back would look like, how we can come back, and, other pieces of that. I mentioned that the DESE guidance was instrumental to guiding our thinking. And there's one piece of that that I want to highlight for the school committee and for the community at large now. And that was some updated guidance that the commissioner's office, in guidance from the Department of Public Health and the governor's office, released at the end of November. And in that guidance, it was November 6th that they gave it. They changed basically the plan for reopening schools based on COVID positivity rates in particular communities. And I would summarize that change by saying, initially they had said, if you're considered a red community, according to the state framework, you should be remote. And then they changed it and they said, we're learning more. And here's kind of where the shift in understanding about COVID comes through the medical community. And this is when we were first hearing more about national studies, international studies that showed the spread of COVID in schools is minimal. And so in a lot of cases, the Department of Public Health and the Department of Education actually were calling around to school districts saying, your kids should be in. Why do you not have kids in school when you have really low COVID rates? And we understand that it's relatively safe to have kids in the school environment. And at that time, they went through, and you can see the beginning of the statement here where the commissioner talks about the color-coded designation for communities and how they were updating it, and it replaces the guidance that was issued on August 11th. So it was a bit of an update, and they go through and talk about the different colors of the communities and what they mean and how you get to be a particular color and all of those pieces. And again, this is right on the DESE website. Anybody's welcome to go and look at it. And they talk about, so based on the new guidance that they had in early November, they were changing their reopening guidelines. And they talked about how districts are expected to prioritize in-person learning. And they go through the different response scenarios and other pieces that are here. And they talk about how districts that are gray or green or yellow should have kids fully in person if they can. In a lot of places, that's not feasible because we can't maintain social distancing. All of this presumes that we're still maintaining effective COVID transmission reduction policies, like using appropriate PPE and social distancing, et cetera. They urge red communities to implement hybrid programs. And you would think like, well, that's Revere, we're red. We've been red since July. That's true. But what the state took the extra step and measure to do was to highlight a few districts that they knew were unique and different. And Revere is one of them. And they said in these districts where there are extremely high positivity rates, and remember, this was back in early November, we need to be more careful. And those districts need to consult with DESE and with the Department of Public Health and with local school officials to try to figure out a plan so that we can introduce in-school learning without jeopardizing the safety of our students and staff in terms of their health. And I just think it's really important to point out the fact that the Department of Public Health and DESE identified a handful of districts, Revere being one of them, to signal out as being a little bit different than everybody else, because I think it highlights my point of all of the guidance we hear around social emotional learning needs of kids and academic learning needs of kids and safety and COVID transmission is really relevant to the context that you're living in when you apply those ideas. And so I know we hear a lot about other districts around us that are introducing winter sports seasons, for example. I'll single out Malden as one of them. Malden's daily positivity rate, 14-day average positivity number is half of what it is in Revere. And their percentage of positivity rate is just a smidge over 5%, where ours is almost at 8%. Those are significantly different numbers. And so saying, well, why is Malden talking about the possibility of starting athletics in mid-January and releasing dates like we'll start practice on January 11th and we can start games on January 22nd. And I will say that Malden has put the parameter on that it implies that they're back in school at that time. Why can Malden put those dates out and we can't? And the answer is because our COVID context is very different than Malden's. Even though we're both red communities, we are in very different places right now. And, so I just want to make sure that people keep that in mind. I'll go on from here and just go back to sharing. Actually, I'm going to put this slide back up for just a minute in case people want to write down a couple of those websites that I've listed there that we use for significant guidance in our decision-making across the district. And we have followed the guidance and we followed the changes to the guidance from when they first started giving guidance back in March. That's when we started listening to the state, the Department of Education, the Department of Public Health, the Revere Board of Health, and all of the other experts telling us what we should be doing, when we should be doing it, and how we should be doing it. And I'll also point out the fact that the school committee, in consultation with the mayor, made the decision, and the school department, I should say, made the decision on March 13th to close schools prior to the governor making the announcement 3 days later, and actually against the advice of the Department of Education at the time, because we were following the medical guidance. And I think that that's the right thing for us to do, is make sure that we're always following the medical guidance. So here on the screen, you see 4 websites that I highly recommend people look at and pay attention in understanding how decision-making is made. And, that leads us to, I think, what is the main question for everybody. And can you confirm that my slide just changed? I want to make sure. I know sometimes sharing doesn't work. Okay.
Yes.
I know the real concern right now is how and when do we get back to school with kids? And I can't emphasize enough that that's what we all want. But we have to make sure that we're doing it in a safe way. without a doubt. And that's the most important thing. We feel like we're ready for that. If all things were moving in the right direction, we feel like we'd be ready to open school tomorrow. We have the right PPE. We understand the parameters around social distancing. We have cohorted our students so that there'd be minimal mixture of kids at different points in the day. And unlike a lot of other high schools in the Commonwealth, we even did that for freshmen and sophomores. So kids would be together with one group of students throughout the day and not be constantly switching and changing, increasing the risk of COVID spreading. Ventilation, I put an asterisk there, wherein all of our buildings are in great shape. The one exception is Revere High School, where we have on order air purifiers for each classroom, because all of the work that our incredible maintenance and facilities team did on the univents still did not give us the number of air exchanges per hour that we wanted. We expect that those air purifiers will be delivered either later this month or early in January. The challenge that we have right now is that our COVID rates is just still too high. And what we really need to do if we want to get back to school is work as a community to change that trend and really make those numbers go in a different direction. I know the mayor's office has put out a lot of information on how people can do that. But quite frankly, that's going to be the most important thing if we really want to talk seriously about getting kids back into school. The priority for us right now, as I mentioned, our priority is to get everybody back. I don't know that that's incredibly valuable. What I do think is valuable is getting our special needs kids back. And we would love to see that happen around the middle of January or late January. We have been talking with the teachers about that. One of the things that we think that we need in order to do that safely is have a weekly testing protocol set up for students and for staff, so that we can quickly remove any asymptomatic COVID positive individuals from the environment before they're able to cause a transmission to others. And in order to make that happen, we really need collaboration between parents, teachers, and the schools. What's not helpful, and I've seen a little bit of it on social media lately, is different groups of people pitting themselves against, pitting others against each other. And all that does is cause more social emotional harm to kids who are listening to those conversations and witnessing those conversations, and makes this an even more challenging time for everybody involved. I can say that there's nobody here who loves the way things are going or loves the conditions that we find ourselves in. And I know that's true of everybody that I talk to. And so we really need to work together to find what we can do and figure out solutions that will work and still be safe. And our hope is that if we're able to bring at least the special needs kids back in the middle of January or in late January, then we can learn from that slow and steadily and start bringing more kids back to school. And we would continue to prioritize high need kids, such as our homeless students and our kids that are living in foster care, our English language learners, and other kids that we know have significantly greater challenges than some other kids might have at home. And so what would the return to school look like? Well, I kind of hinted at this before, but our space constraints mean that we're probably not going to get back to a full in-person model of learning until next school year. We just can't socially distance effectively. And as everything with COVID, we never know what change is going to come down the pike. I'm thrilled to hear that people are receiving vaccinations in the state of Massachusetts beginning next week. I don't know how soon those are going to find the arms of our teachers or the arms of our students or the arms of the other people who work in the school department. And all of that is going to be necessary before we can have class sizes in the 20s again. So that's something to think about. I think that realistically, our best bet right now is looking at remote, which we're in right now, and hybrid models. And I know that there's a push to get back to school. I agree with that push. I know that kids need to be back at school. I know that they need activity and communication and collegiality and relationships. It's all very important as long as we can do it safely. And one of the pieces that worries me a little bit about that going into the spring, and I think it's an important conversation to have, we don't need to have it right now, but we should be talking about what we're learning from other districts that are currently in hybrid models and what's working for them and what's not. I know personally, I have some nieces and nephews that are in a school district that's currently hybrid, and their parents are dissatisfied with it because they go to school 2 half days a week. And there's not a whole lot of structure around their asynchronous days. And they actually feel like they're getting less direct instruction with teachers now than they were getting when they were full remote. So there's give and take on all sides of these. And I just think that, again, I would urge everybody to work collaboratively and treat each other with grace, so that we can decide what's best for the revered children together, following the significant guidance that we do have from the Department of Public Health and our other medical professionals. And I will stop talking now.
Thank you, Dr. Kelly. I also want to make note that Mayor Arrigo did join in on the meeting about 10 minutes ago.
My apologies for being
Stace,
late,
Miss-
everyone.
Oh, no worries. Thank you. Ms. Rizzo?
Yes, thank you, Diane, for the information. And of course, we all want a reopening plan that is not too ambitious or too cautious. So we won't need all the information that we possibly can to do it the right way. My question is, when is the last time a parent-family survey was done? And, well, for now.
The survey, I believe, closed on Thursday, Wednesday of last week. And we have been working on crunching the data. We intend to present that at the school committee meeting on Tuesday.
Okay, is there any, what type of questions were asked? Like informational questions that you're trying to get the data?
I don't know if Danielle, feel free to jump in here, but we asked questions about what resources they had and what resources they felt they need in terms of technology, internet, Chromebook, that kind of stuff. We asked about the amount of synchronous work and the amount of asynchronous work that their kids were receiving, and whether or not they thought it was appropriate or too much or too little. We asked about communication from the school and the teachers, if they felt like they were being communicated with effectively and with the right amount of frequency. I'm trying to think of what else, Danielle. Homework, we asked about the amount of work kids have to do independently. We asked about the pressure and stress on them to help their kids get their work done.
So that's a well-rounded survey. I look forward to the data on Tuesday then. It's very informative.
And we did have over 3,000 parents respond, which is a good representative
Excellent.
sample.
That is good.
You know, I'm also asked attendance. How's attendance been going with remote learning?
Attendance has been very good, actually. And we've actually really narrowed the gap on the number of kids that we haven't been able to communicate with and engage since the beginning of the school year. We're down to just 5 kids.
Oh, good.
So that's been good. We do have some kids at every school, and the principals and the social workers are working with them and their family, who we don't feel like we're getting enough engagement from. In some cases, the kids log into a class. They're required to show themselves so the teacher can establish attendance. And then they sometimes turn off their camera, and even when the teacher tries to call on them or whatever, they're not necessarily engaging. But the teachers first try to work on that with the family, and if they don't find success, the social worker and the principal, or the assistant principal, I should say, step in, and they begin communications with the family. And we've made a lot of progress with a lot of kids in that situation.
Okay, I have a lot of questions about the survey, but I'll wait till Tuesday. I'm sure there's some answers right there. Thank
Okay.
you.
Thank you, Mr. Rizzo. Mr. Ferrante?
Thanks, Susan. Diane, assuming that the buildings are all safe and they're ready to go by January, including the high school, what would stop us from starting school mid to late January to start with the special needs and the high needs children?
The one thing that might stop us right now is the positivity rate in Revere. So what the CDC and the Mass Department of Public Health have identified as high COVID rates is more than 8 cases per 100,000. We're in the 60s. Actually, I have the number. I looked it up. Sorry. We're at
And I'll
59.2.
I'll chime in at this point and say that we had just today 110 new cases. So just to give people an idea of what's happening day over day.
Yeah. And the positivity rate in Revere right now is 7.85%, so very close to 8%. And that should be closer, that should be 5 or less. And like I said, Michael, the state has said, if you don't quite hit those matrix, if we were at, 10 cases per 100,000 and a 5.1% positive rate,
Right.
we'd be having a very different conversation than what we are right now. And, even we've talked already about how the guidance changes. So if we back up a month ago, they were saying schools are safe, there's no transmission rate in schools. And now they're saying schools are safe, little kids don't transmit, older kids do. So as time goes on, we are definitely learning more and more about COVID and who's impacted and how it spreads and where it goes. And right now, and as we have been since July, Revere is just a very, very high transmission rate community. And that's not shocking, given the density of this community. People live very close to each other, and we have a lot of multifamily homes. I grew up in Dorchester. I live there still. It's very similar. And that's why even when we look at the community in Boston, which has a much lower rate than Revere does overall, but it has dense pockets of higher COVID positivity, and the community that I live in, Dorchester, is one of them. So I just think that we have to make sure that in the decisions that we make, regardless of how frustrated we all are and how frustrated parents are and students are and teachers are and everybody is, we really have to, I think, pay attention to the guidance that we're getting from the medical field and the medical community, take that seriously and let that be our guide in terms of making any changes to the plan that we very thoughtfully created back in August.
All right, so moving forward, obviously those numbers are spiking through the roof right now.
Mm-hmm.
If we were to get back, do we need both of those numbers to work, the 8 for 100,000 and positivity rate 5 or less %, or is it one of the two?
Technically, we need both of them.
Okay.
But I think that that's the kind of place, Michael, where we could look logically at the numbers and think about, see exactly where we are then. If we're close on one of the numbers and not close on one of the other numbers, then we can look more deeply at the data and try to understand why that is. Those numbers typically should move together. So when the positivity rate is going higher, it means that you're having higher average daily number of cases. So like with the mayor mentioned, we had over 100 today. That positivity rate of 7.85 is probably going to jump over 8% when the data comes tomorrow. And this is the data that the state releases every Thursday. So we can see that going up, but we don't know what's going to happen from there. Like right now, we understand that we're still in kind of the Thanksgiving lashback. So it could be the case that if we go through Hanukkah and Christmas and New Year's and Kwanzaa and people properly social distance and don't have big family gatherings and do those things, we might not see that same kind of spike in the coming weeks. If we're able to control that spike, then our conversation after the new year is very different than it is if we continue to spike or even have a higher spike because of the increased number of holidays that are coming up in the next couple of weeks.
All right, I just have 2 quick ones. If we can get the numbers to work for us and get the kids back, how much time do you guys need, being the school department, to get ready with transportation, the teachers and whatever? How much time would we need, like a lead time to get the thing going?
I think an appropriate lead time would be 2 weeks.
Do we? Okay. And my last question is, and I know we want to start with the high needs and the special needs children. What is the plan? Because you said we can't do a full go back. What would be the next step after the special high needs kids? And what's the time frame? Is it like a couple of weeks difference, or if we can get back, obviously? Like, would
Yeah.
the next one be elementary, then middle school? But what is the time frame? Is it like a couple, 3 weeks, or what are we looking at if we can get back, obviously?
I think that the question about special needs kids versus everybody else is a little bit different. Because, as I said, I'm still hoping, even though we know we're pretty sure that our positivity rate isn't going to be low enough, I'm hoping if we can set up a testing program that we can get those special needs kids in, around mid to late January. I think that with larger groups of more concentrated kids, it might be a little bit of a different conversation. We have to think a little bit more carefully about what those positivity rates are. So that could be a longer term question on when those kids are able to come back. But I do think, you mentioned elementary first and then working up from there. I think for one reason that's a good idea is because of consistently now since the summer, the experts have been telling us that little kids don't transmit. So if we have a testing protocol in place, it would be a little bit safer to have the little kids in than it would be to have the big kids. And that's a question we need to ask. And I think that another thing that we should look at if we do get those positivity rates down is rolling in certain grade levels at each grade band. So we might do K1 and 2 at the same time that we bring back grade 6, because that's a different school. And at the same time, we bring back maybe grade 12, so that we can give our seniors a little bit of a year. And then, from there, we look at when we, assuming that we're at the right positivity rate and it's safe to reopen, then we would look at how we, maybe it's a week later that we roll in the next couple of grades, and then until we get everybody back in all together.
So it'll be done over a period of time.
It would be done over a period of time. And, another good point, and I want to be fully transparent and talk about everything here because I don't want there to be any surprises down the road. Like, we could be talking about, by the time we're having that conversation, it's March, right? And at that point, we have to think about whether it's feasible. Think of where we are. Like right now, if you talk to kids and parents and teachers, they will tell you that they have found a bit of a stride. There's a routine. Everybody understands how this works, what's expected of them, how to do the day-to-day, how to do the week-to-week. If we change to a hybrid, we're going back to a whole new model. And so there's going to be another transition period there. And it's going to take some getting used to. And in a hybrid model, remember, the kids are in and out of school. So there's not that structured, systemic, this is how it works. This Monday is the same as next Monday, the same as the last Monday. It's going to be very different and a little bit more chaotic for kids to manage. It's something that we should think about if we're getting later in the school year, whether the advantages outweigh the disadvantages to that kind of a change. When we think about kids' social emotional well-being, that will impact their social emotional well-being. So it's something that we should think about. And I just want to be transparent and say that out loud.
Well, let's get the first step one before we get
Exactly.
to the rest of it.
That's right. Yeah,
Let's
I don't
do
want to put
step
the
one
cart
first.
before the horse, but
Right. All right, thank you.
Thank you, Mr. Ferrante. Ms. Ty, did you have a question? You're muted, Carol. Carol, unmute. Carol, you have to unmute.
Yeah, right.
Are they-
Diane muted me when my phone rang.
Oh,
So, but I shut it off quickly. Okay, that's, I'm hearing that, Diane. I just wanted to buttress that argument that you just made, that right now, people seem very satisfied. There are exceptions, of course, but very satisfied with what the teachers have done and what they've been able to do. And certainly in the presentations that we've had at school committee meetings, we have seen how the teachers have stepped up and have managed to do all the things that they can do, particularly the Paul Revere presentation that we had, the Hill School presentation, and I look forward to hearing from others. But the Volk School, which has gone into a hybrid model, it's not easy. There are real growing pains in that, because a child who's had a teacher from, say 8 o'clock in the morning until 2 in the afternoon, whatever the hours are at the Volk, a teacher or another teacher all day long, now doesn't have that, does go to school in a couple of days, but it's a long day. Somehow or other, there's a problem, I think, with food service there. I'm not clear what that is. There's some talk on social media about this. But there's a loss involved in that, in not having your teachers all the time, because if you're there for just a couple of days and you're not being guided by teachers other days, that's very difficult for a child. And I also think it's very difficult for a teacher. So there are no absolutes in this. This is a horrendous time. It's just move along. And Diane, you've done a great job explaining all of this. And thanks for doing such a great job. And for the rest of us, I read everything every single day in the Globe about all of it, everything that's online, all the arguments, and the arguments are all the same everywhere. We just happen to be different because we have such a high positivity rate. And I like the word that Diane had used. She said we follow the medical models. And I think that's our only choice, is the medical model. Thanks.
Thank you, Ms. Ty.
Susan, I don't know if you can see, but the mayor has his hand raised.
Oh, I do not see that. Yes, Mayor.
Thank you,
Arrigo,
Ms.
sorry.
Gravellisi, and thank you, Dr. Kelly. Just a couple points. One, I apologize again for being late, but I do want to start off by acknowledging and recognizing the level of anxiety, and I think the level of frustration that everyone is feeling about the situation that we find ourselves in. And it's one that, it sucks for everyone, right? And so there's no other way to really put it. So we're doing the best that we can. We're obviously gonna follow the medical guidance that we have, and we have, the city has assembled a great team, and I know we're working regionally and listening to folks to make the right decisions for the community. And I'll make the plug again. I mentioned the 110 new cases today. I can't say it enough that people need to take the practices that we've been preaching for 9 months now, or 10 months, and continue them. Wear their mask and practice social distancing. Don't see folks that are outside of your household, and we can get through this. On one thing that I wanted to mention, and Dr. Kelly kind of started to go down this path of thinking forward, and I don't want to get ahead of ourselves, but has there been any conversation, and I guess this is more for Dr. Kelly than anyone else, has there been any conversation about what the summer looks like, and if we do get through this, is there potential for folks to be looking at the summer as a time for learning to happen? And has the state kind of been thinking? I assume that the state's thinking through this, but has there been any kind of conversation about that?
Truthfully, there hasn't been. And I think that a lot of that is funding dependent, and that's why I do think that when we see some changes in the Federal Department of Education around the end of January, we'll probably see new funding streams that might help us engage kids who have had some learning loss. You'll recall that we had hoped to do that last summer. We had planned to do it. We did have some CARES money to do it. But again, our COVID rates prohibited us from doing what we had hoped to do. So we would like to do that this summer. And, from what I'm hearing, and Mr. Mayor, you probably know more about this, but I'm hearing that by midsummer, we would have widespread inoculation against COVID. So we should be able to have a pretty robust summer program.
Right. That is, yeah, that is a hope. And I think that's I guess the light at the end of the tunnel, if there is one, is the summer. And that's why I mention it. And I just want to maybe put that on people's radar as well. One other thing that I want to note, and I think it's important because what we do in the city and the restrictions that are applied and how we kind of react to the ever-changing kind of environment that this virus has presented us with has a lot to do with what happens in the schools, right? And so, and this is more just for general knowledge, but many people have probably seen that the city of Boston is moving towards having close to or over 2,000 students coming into their buildings, and they're moving towards a model of providing in-class space for their most at risk and their highest needs students. And at the same time, they're thinking about additional restrictions. The governor has laid out additional restrictions, and the thinking behind that, the logic behind it, is that that the mayor knows that there's going to be additional spread potentially with more kids going into their schools. And so if there are things that Mayor Walsh thinks he can do to prevent spread in other places, then he's going to take those measures and those restrictions and try to find that balance of providing, really important education to children and families that need the support, but also understanding what is spreading the virus. So I say that because, I think certainly every decision I make is not a popular one, especially over the last 9 or 10 months. And I want people to be thinking about, I certainly take a look at what other communities are doing. We try to adapt and take the appropriate action that works for our community, but we want to know what other folks are doing. And that's one that I think is relevant for this conversation, because they are opening up more classrooms to more students, but at the same time restricting behavior for the rest of the community, or they're at least looking at restricting behavior for the rest of the community. So those are things that I want people to be thinking about. I know that these are issues that a lot of people are tuned in on and care about, and we want to, I think everyone, I can't underscore this enough, everyone wants to get back to a point where our children are back in their classrooms, and that's just it right now. Is unfortunately it's not possible, but we, I say, I guess I do, and I think I speak for the entire committee when I say, and I think the entire community when I say that we feel the frustration that our families and our children have around not getting back into school. One last thing, and I'll end with this, is that it was absolutely heartbreaking for me to read to children the week of Thanksgiving and hear, I can't even count how many times the first question was, when do you think we'll be back in school, or why can't I get back in my classroom? And that's just that's tough to hear. It's tough to hear from children. So we'll get there at some point.
And if I could add one other group to the mayor's list, I know that there are a number of teachers who have reached out to me and come and met with me and said, I just need my kids in the classroom. I can't do this remotely. It's not as good. I want to see them in front of me. I want them to be in the room with me. I feel safe. Please let them in with me. That is great. We understand that there are a lot of teachers who are as frustrated as parents and students about the remote learning. But we, still, as we've said repeatedly today, have to follow the medical guidance.
Thank you, Dr. Kelly. Mr. Rizzo?
So trying to stay on the positivity route of perhaps even our special needs students can start maybe the middle of January, do we still have the opportunity from DESE to get the Bionex Now rapid tests? And
We do. The DESE plan isn't quite what we need because the DESE plan only allows for testing of symptomatic individuals. And what we're actually hoping to do is set up an asymptomatic weekly testing protocol because that's where our greater concern is, especially with kids, but also with adults, that people don't know they have COVID and are coming into the school, and it would be very unlikely, but still a possibility that they could spread it. I mean, everybody's wearing masks, everyone's 6 feet apart, we have good ventilation, we're doing the right thing. So it wouldn't be hugely likely that there'd be a spread, but we still want to make sure that we're as safe as possible. And you know, the last piece that I see in making that happen would be get that kind of asymptomatic surveillance testing program set up so that we could identify positive asymptomatic folks quickly and remove them from the environment before they have the chance to spread.
But just so that we can make sure we get to the place that we know immediately with the Bionex test, they would still need the molecular test after if they're not asymptomatic.
If they the Bionex Now test, I think, is the one that you're talking about.
If they have symptoms.
Yes. If they test positive, the Bionex Now test is quite accurate in identifying positivity. Where it's not as good necessarily, and I believe that it's improved. The research has shown that it's improved. I can speak to the group of doctors that I've been consulting with on that. I know that Neera Pollock, who is the head of infectious disease at Boston Children's, did a research study at Lawrence Memorial Hospital where they did the PCR test in parallel with the Bionex to test the alignment and what the results were. And the results of her study are going to be published in the next week or two, but they're very positive results. They showed a significant amount of alignment, both in test kits that came back positive and those that came back negative. And one of the things that was unique about Dr. Pollock's study is it included children, which most of the research studies have not included to date. So she, fortunately, is one of the people that we're able to consult with and that we have been consulting with through the Safer Teachers, Safer Students program, and trying to set up this kind of surveillance testing system.
And just maybe a question for Mayor Arrigo. Is there any kind of data for the numbers that we're getting that are testing positive? Do we have data of the ages like 1 to 19? And maybe not?
I believe that data exists, Stacy. I believe that Ruben Cantor in the Mayor's office has been maintaining that. So we could maybe ask for that. I don't know the numbers offhand, but I do think, and the Mayor's probably momentarily unavailable, but I do think that Ruben would be able to provide that for the school.
Yeah, I think that data is also very crucial to getting the kids back into school. If we're not seeing any, case, and yes, our 16 to 19 population has gotten higher, but it'd be good to just track that.
Thank you, Ms. Rizzo.
Thank you.
Any other questions? No other questions from members. Okay, Dr. Kelly, did you say we had people waiting?
Sue, can I just ask one more thing? I'm
Yes.
sorry.
Go right ahead,
sorry.
Ms. Rizzo.
Dr. Kelly, is it possible, and we spoke briefly earlier about it, if we can have some kind of question and answer with our families and students to give them an opportunity to speak and maybe get some, I've gotten 3 letters today of parents that aren't crazy about coming back, but then I have about another 20 that want to be back. So if we can just help all of them and get some questions and answers for them.
Yeah, and I know that Dr. Golenbach, who has spoken to the school committee and to families and to staff, I was in touch with him last week, and he's very much willing to come back and talk again about exactly what's happening with COVID and what
great.
we can expect going forward. So I'll work with him to set that up, and we can focus both on the medical aspect and on the school reopening, how that impacts
And
where we are.
could we kindly make it for a time that it's convenient for, like after 5 o'clock, so that
Yeah, I
students
think,
can ask questions? I feel bad today. I didn't think of students still being in school and parents might be working. But I did try to explain to some of them, this is more of a working meeting. It's not like our regular meeting. But just to give them a platform would be helpful.
and we can also repeat a lot of this discussion on Tuesday night at our school
Mhm.
committee. There is
Of course.
COVID update on that agenda.
Mhm.
And there is a public speak portion there. I don't know. I know typically public speak is at the beginning of the meeting. If we wanted to move that to the end of the meeting, would be the prerogative of the school committee, but I think that might be a good idea.
Okay.
Okay.
No other questions?
There
Yeah.
are some participants in the waiting room, and I had suggested to them, this is a little bit awkward because this is set up, as Stacy said, because this is not a regular school committee meeting. We were not anticipating public comment, but I asked the people in the waiting room to listen on YouTube so they could watch the discussion, and then I would elevate them if they had a question. So I'm going to do that one at a time, but I have no way of knowing whether each person in the waiting room has a question or not. There are only 6 people there. So what I'm thinking I would do is just elevate them one at a time, and they can ask a question or make a comment if they have one, and then leave the meeting. Does that sound all right? I hope.
Absolutely.
hope
If
we
they've
don't-
been waiting, then we should hear
Yep.
them.
Okay.
And we just also want to mention that, any questions or comments during public participation, which normally we don't have at these committee of the whole meetings, but we will today, are limited to 3 minutes, please, per speaker. So if everyone
Okay.
could just be respectful of that, we'd appreciate it.
Okay. And I'm going to start with Counselor Patrick Heath. Hi, Counselor.
How are you, Dr. Kelly? School committee.
Doing all right.
Well, thank you. And I don't want to take too much of your time. I do want to say that, I totally appreciate the work that you all have put forward. And of course, the teachers, the janitors, the facilitators, everyone in the school system. And I know that, how you doing? You there?
Yeah, we can hear you.
Sorry, I was getting feedback from the YouTube. But what I want to say is, I think I realize everyone does want these kids back to school. No one wants to be dealing with the pandemic. No one wished this upon any of us in whatever changes to our lives. But of course, we are here. And I thought it was important to bring up just a couple of key points. It has been 8 months and we haven't seen a lot of change. One of the things that I noticed is, it seems as if there's a lot of resistance from a certain group to get back into the schools, and in the sense that there's a moving target. Because if you look back just about 2 months ago, we were starting to see a relatively steep decline in cases. We're, maybe 3 months, 2.5 months ago, cases were coming down, positivity rate was coming down. We were starting to look really good. Now, again, that has changed, but there seems to still be that same resistance to want to even have the discussion of getting children in the building, never mind getting people in the building. So I just want to be cautious that, we have to set some standards of what the city wants and what the school committee wants, and of course what you want to make the decisions, rather than, specific groups that maybe have different interests in mind. I just think that's very important because the schools are built, the schools are there to serve the children. That's what they're there for. They're not there for you. They're not there for me. They're for the children. And I think you all agree. The other points I wanted to bring up was, regardless of, I'm kind of alluded to the fact that my children probably won't go to school this year. I do think it's more important that we serve the higher need community, the high risk students, English language learners, special needs. I fully agree with that. There's other cities and towns that are finding ways to make this happen right now. They're also having learning centers. Chelsea does it, for instance, where they have rooms set up with keyboards or desktops, laptops for students that don't have that at home, and they're doing it right now. So I just don't understand if that's something, we're able to offer it to AlphaBest at a cost. We should be able to offer that to our Revere public, people that are enrolled in our school system, that pay the taxes to our city, to be able to utilize those buildings with guidance. And I know that there could be lots of, it doesn't necessarily need to be a teacher in there. Of course, if a teacher wanted to do it, that would be fantastic, but someone to help monitor the rooms and help these students. I think that that's something that you should look at doing immediately to help serve that needy population. And then really, there's so many things I wanted to talk about. I just wanted to kind of make a couple more comments with all due respect. Again, this entire group has more knowledge about the schools on their pinky fingers than I have in my entire brain. But I am a parent of 2 children that go to your schools, and I'm very proud of what they get. To say that they're in a routine right now is probably absolutely true. The routine is not good, though. That's not a fun routine. It's not a routine that anyone, and I know you don't wish upon us. You and this group has set a very high standard for our students and our children and what we come to expect. But the routine they're getting right now is obviously less than ideal. And then the last piece is just touching base on, I know Stacy mentioned it with, the calculation of, the positivities and how that's being and who's really being impacted. I think the data does show that the younger population obviously is not testing as highly as specific populations. But again, how does a city like, how does a school like, I'm just going to use St. Mary's, for instance, that takes students from Lynn, very high cases, Revere, very high cases, Malden, very high cases, Salem and Peabody, and they're able to take all these communities and commingle them, and they're finding success, and we seem to be less willing to want to do that, and I just leave it with it's a private versus public piece, and there's competition. So Lynn has to be, St. Mary's has to be competitive. We don't, so there's no real incentive to be competitive with putting people in our building. And I get it. Like, I'm not saying today should happen. The cases are obviously very high. I don't want to put people at risk, but we have to get the mindset of being in a private versus public sector needs to be more equal, because that's where you're limiting yourself. All right. But I appreciate your time and thank you for doing this. And again, I want to state it for the record. You guys are awesome. I'm sorry that everyone's going through this. I think the teachers are great. I think the janitors are great. I think everyone in the school system is fantastic. And I know that, like Mayor Arrigo said, this, it's not fun. So thank you very much.
Okay.
Thank you,
Patrick.
Counselor.
Thank you, Patrick.
I don't know if you can go back, or if I make you leave. How does this work? Anybody know? I think if I remove, you're out altogether, Patrick, but you can watch it on YouTube. Is that okay?
Okay.
Okay. All right.
I just put him in the waiting room. He's back in the waiting room.
Oh, okay. Thank you, Danielle. I'll let you just be in charge of that, and that way you'll be able to figure it out. I'm going to bring in Susan, who's on iPhone 2. Looks like Susan might be having an audio problem. So while we wait for her, I'm going to bring in Eric. Eric, did you have a question for the school committee or for me? Nope, Dr. Mokaba, I guess you can.
Diane, are we supposed to have their name and address for the record?
Mhm.
Yes.
Oh, yeah, sorry,
Make sure we get name and address.
that's Susan's fault.
It is. I'll take the blame.
Name and address.
I'm gonna bring in Dora is the last person in the waiting room. And then I actually have one letter that I got from a parent who asked me to read it.
And then actually, Dr. Kelly, after that, Mr. D'Ambrosio received a communication that he'd like to read.
Okay.
And also, I did too.
Okay.
I'm gonna bring in Dora is the last person in the waiting room. Dora, did you have a question?
No.
You just listening? Good to see you. All right.
Nice to see you.
Hi, Dora.
Hello, guys.
Okay. Is it okay if I go first?
Yes.
Okay. This letter is from Kristen Mariano. I do not have her address. I apologize for not getting it. We were corresponding over email. And she wrote, good afternoon, Dr. Kelly. I'm sending this email since I'm unable to attend the school committee Zoom meeting today. This is my first time emailing you since school has been closed. I would like you to know how my daughter, Ava Mariano, is struggling with her schoolwork. She's in the 7th grade at Garfield Middle School. She's missing many assignments and is struggling daily. I've been in contact with the school, and in the past few weeks, they have been very helpful and accommodating. That being said, Ava would benefit more from being in a classroom with teachers who could help her. She's a visual hands-on learner. I know the decision to open schools is a tough one, but please take into consideration my request as a parent and somebody who is genuinely concerned about the well-being of my daughter and the many kids in the district. I'm not expecting a full-on open, but maybe a hybrid plan sometime in the near future. Thank you for your time, Kristen Mariano.
Thank you, Dr. Kelly. Mr. D'Ambrosio, did you want to read your communication?
Absolutely, thank you. This is a communication submitted by Gina Garro, who's a teacher within the district, and I'd be happy to read it. The Revere Crisis Action Team, a group of RPS teachers who have been working together for the safe reopening of our schools, would like to share our thoughts about a return to face-to-face learning in light of the worsening coronavirus pandemic. Like most of you, back in March, we hoped that the pandemic would be under control in a relatively brief period of time and expected a return to in-person teaching late in the spring of 2020. Sadly, it became clear that we are not going to return to school buildings until September, then October, then November. It is now December and the pandemic is still raging. We understand that teaching and learning via Zoom or Google Meets is difficult for all involved, and we wish that it was safe to return to our classrooms with our students. Despite how teachers are being portrayed by some, we are not villains and want to go back to our classrooms when it is safe. Unfortunately, metrics for safety conditions have not yet been achieved, so this is not possible right now. We are working hard to get our ventilation to meet adequate A-share standards. We are actually following the health metrics of DESE, which say, given our numbers, that in-person learning is not safe right now. Until that time, we will continue to do our best to meet the educational needs of our students while also working to ensure the health and safety of our members, our students, and their families. And again, that was from Gina Garro. Thank you.
Thank you, Mr. D'Ambrosio. Ms. Rizzo? You're muted, Stacy. Stacy, you have to unmute. There you go.
Okay, this first one is from Vanessa Biasella, 10 Roberts Road in Revere. Hello, school committee members. Thank you for reading my submission. I am writing to you as a parent of 2 students at the Wayland. Michael C. is in 3rd grade and Joey's a 2nd grader. They are both sad and having a terrible experience with remote learning. My son's mental states have declined and their view of school is deteriorating at an exponential, they can't use big words for me. This is all besides the fact that there is an issue with Comcast that is causing frequent cutouts in my neighborhood, and they don't know when they'll be getting to it. The stress of an unexpected cutout of internet on an 8 and 7-year-old who are worried about missing what the teacher says or getting into trouble is a stress I don't wish on anyone. With that, I am gravely concerned about their ability to succeed in the remote setting should it continue much longer. I am not going to cite statistics or facts. Those speak for themselves and support full return to school. I know that remote learning isn't good. I know our kids need to be back in the classroom. I know the harm being done in the remote setting completely supersedes any good. We need to consider the whole child. Academics matter, not when the student's very basic needs are not being met. I am a teacher. I teach special needs ELA at Lynn Classical. I speak for my 97 students and my sons. Get these kids back in the classroom. We are losing more and more kids by the day. Yes, some have literally quit, but more importantly, their view of education and their desire for success is diminishing, and that damage is permanent. The mental strain is causing two major responses. Half these kids are checking out, and the other half is stressing themselves sick. This needs to end. Now, as an educator, I can also tell you the vile and evil things being said about teachers is hurtful and nasty. We need to support our educators more than ever right now. My colleagues' work never ends. There is always, oh my God, there's always tech issues. Our job is one that is 24/7 and all encompassing. Our kids need us, we need your support, and we all need to be back in the classroom where we can serve our students by meeting their holistic needs as little humans who desire to be successful. Michael C. and Joey desperately want to go to school like regular kids, their words. Folks, these kids are losing their childhood and remote learning now. Thank you, Vanessa Biasella. Someone just said I didn't have to read theirs, but there's another one that asked me to read it, but I'm going to need a minute to even find it. And I apologize. So if someone else has a letter or something to need to be read, I'll look for the other one.
I could actually, if you, sorry, did somebody else? Sorry, go ahead, Susan.
No, I was just going to ask if anyone else had any communications to read. No. Okay. Dr. Kelly, go ahead.
I did get, Stacy had asked about the positivity rates by grade, by age span. And Ruben Cantor from the mayor's office did send that. So I'm going to try to share it here again. Share my screen again, I mean. This is, can you see like a table and a graph?
Yes.
Yeah. Okay. So this is Stacy, the under 19 is just this top row by month. We see the trend where, remember, early in the summer or in the very beginning, there were not a lot of kids getting COVID. And we've seen that steadily increase to roughly 20%.
Diane,
Wow.
if you have a chance, can you share that with us via email?
Yep, sure.
Thanks.
I'm sorry, this is percent of all cases?
In Riviera, this is Riviera.
By age group, yes.
Yeah. And you can see the average age over the months has dropped from an average of 50.8 years to now 36.5 years. And again, that's an average. So those numbers on the extremes, the very elderly and the very young are gonna. Yeah.
Mr. Izzo, did you,
Yeah, I did find it.
okay.
Aren't you lucky?
Great. Thank you.
This isn't controlled by population size, right? So there's no control for what percentage of the population is made up by each of these age demographics?
No, I believe it's a straight raw. I can ask Ruben that, but I believe it's a straight percentage of positive cases, period.
Okay, this next one is from Melissa Randall, True Street, Revere. Good afternoon. My concern and disappointment of the continued school closure intensifies each day. As a Revere resident, I carefully follow the COVID-19 data, and I am well aware that our numbers do not support full in-person learning this year. However, at some point, will there be any discussion or plan put in place about having our students return to in-person learning this school year? Is there any discussion of a hybrid model, and when it would be implemented? Is there a timeline? Also, is there an opportunity for those teachers who want to be in the buildings? There are many of us with their students, and parents who want to send their children into school buildings. There are many of those too, to be able to do so. From what I have heard at the recent school committee meetings, reading in the thorough district HVAC reports and recommendations of CDC and medical professionals, and seeing my own school building, our schools appear ready to support in-person learning. As a teacher and a parent, the loss of 10 months of in-person learning has been devastating academically, socially, and emotionally. Remote learning and teaching is not working, and it is not effective on many levels. I feel that many of our students will never bounce back from the loss of in-person learning they have experienced the last 10 months. We are failing our students and children. We need to prioritize their needs and get them back into their classroom and school environments where they belong, like thousands of other students across the state are and have been for months without incidents. Thank you for taking the time to hear my thoughts. And like I said, the third one just texted and said I didn't have to repeat what so many have said.
Thank you, Ms. Rizzo. Were there any other comments, questions? If not, we can move on to agenda item number 1.
Susan, one quick one.
Yes, Mr. Ferrante.
Diane, do you want to talk about the letter that you sent us from Commissioner Riley about the MCAS real quickly?
Sure. One of the things that we've been working on quite a bit, and I know that this school committee signed onto a letter from MASC around putting a moratorium on standardized testing. I know the mayor signed off with a group of other mayors on a similar letter that went to the elected officials in the Board of Education. And I co-authored a letter that was submitted to the Board of Education and elected officials on behalf of the Urban Superintendents Group. We all agreed that that trying to administer the access test in January, which requires in-person testing for English learner students who are in the younger grade levels, and other significant in-person testing for English learners across all grade levels, was going to place an undue burden on the students, the teachers, and the school district. So a lot of English learner students are concentrated in our urban school districts. In Revere, we have 1,650 kids who would have needed to complete such testing just after the new year. And we also talked about the burden of MCAS, the unfair burden that places on students who we all acknowledge are not engaged in an optimal learning environment right now at this time. And how unfair it would be to place that on the shoulders of students. The commissioner heard those messages from all of us, and I'm sure from many other people as well. And what he has said is that they have opened the access testing window throughout the duration of the school year, so that we could choose as a district to not administer access in January, which we are going to choose to not administer access in January. Technically, there is still the requirement that we administer that exam by the end of the school year. But it's one of those things that I would anticipate might also change in the coming months. So we're going to put it off for now and see where we get as we progress. In talking to Mr. Mogavero, we both feel that if we do have to administer that access test, the best time to do it would be at the very end of the school year, when the kids have had as much time learning as possible. And we may have been able to engage them in some in-person learning by then. Time will tell. In terms of the MCAS, the commissioner gave relief to, we had, up until now, the anticipation was that we were going to have to test any student in January who had not already passed their 10th grade MCAS. So for us, that would have included all juniors because we did not offer the exam last year. In addition to seniors who didn't pass their first time out of the gate when they were sophomores and didn't have the opportunity to pass during retest last year because they were not, well, there was one retest administered in November, but we didn't have the March or the June retest. We have 5 seniors who are in that category. No, I'm sorry. We have about, I think it's about 80 seniors who are in that category. And we have 5 postgraduate students who have already completed their time with us, but haven't yet passed MCAS and continue to have that opportunity to do so they can earn their diploma. That's where we have 5 kids. Sorry, I was confusing my data for a minute. And Mrs. Finn, who's our director of guidance, has been in touch with all of them. The way the MCAS requirement has been changed for January is that we only need to offer the opportunity for the retest to the seniors and the postgrads. So our 400 some odd juniors do not need to pass MCAS right now. And, you know, just speaking for myself, it's another one of those things that I'm wondering if there wouldn't be some changes in the next couple of months where we see a moratorium on standardized testing across the nation. It's not something that Secretary DeVos has permitted to date, but I wonder if when there's a change in administration at the federal DOE that might change then.
Thank you, Dr. Kelly. Okay, with that, I would like to make a motion to go into executive session to discuss agenda item number 1.
I'll second.
And do
You should
wanna-
make it, Michael, and not Susan.
All right, I'll
She's-
make the motion. I'll make the
Okay.
motion, Carol.
I'll second.
Michael, could you indicate in the motion that we will not be returning to the floor?
Yeah, we're making a motion to go to executive session and we will not return to the regular order of business at this time.
Second,
Mrs. Bronston Rizzo,
Yes.
Mr. D'Ambrosio,
Yes.
Mr. Ferranti,
Yes.
Ms. Gravellisi,
Yes.
Mr. Sinella,
Yes.
Ms. Ty,
yes.
Mayor Arrigo.
Yes.